Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy, and good afternoon, everyone. It's been 11 weeks since our first news conference announcing our first case of COVID-19. That was 76 days ago. And every day since, Dr. Strang and I reported new cases. Today, we come before you with good news. No new cases to report. 0. That's exciting. Dr. Strang and I want to say thank you. Your sacrifice and for your patience and your hard work is paying off. Wouldn't you agree?
Absolutely, Premier. Thank you. Like the Premier, I'm very pleased to report that this is our first day with no new cases of COVID-19. So the total number remains at 1,055. This is a significant and encouraging milestone, and I too want to thank the hard work that all Nova Scotians have done to take the risk of COVID-19 seriously and follow public health measures. And I want people to know that both the Premier and I fully recognize that the challenges that it has presented for individuals and families and businesses, that we're very much aware of that. It hasn't been easy, but we are seeing positive results. So again, thank you to everybody. This time we have one long-term care home with active cases of COVID-19, that is Northwood, that now has 10 residents and 4 staff who are ongoing active cases. So even in Northwood, they continue to show progress. The QE2 lab continues to work around the clock, and our new testing strategy is working. We processed 1,034 tests yesterday, but we still had 0 cases detected. So that's very encouraging. It's exactly what we wanted to do. Test lots of people to make sure we're not missing COVID, but anticipating we'd see little to none. We now have 8 individuals in hospital, 3 of those in the ICU. 978 people can now be called recovered from their COVID infection, and we've had 40,914 people who have been tested, with negative results. Premier.
Thank you, Dr. Strang. Earlier this week, we announced our economy will begin to restart on June 5th. I know there are still some questions around that, and information is available to you on our Reopening Nova Scotia webpage, along with numbers you can call for assistance. Today, I'm happy to announce that we are increasing the gatherings limit from 5 to 10 people. You must still stay 6 feet apart unless you are in your family bubble. I know many of you wanted to add to the family bubble household. Well, we are not there yet, sorry, because that involves physical contact, and we will still need to limit that. But 10 of you can gather in the driveway, in the backyard, in the park, or even inside your house, as long as you stay 6 feet apart. There is one exception to the gatherings, though, for funeral and weddings. We are allowing 15 people to gather. Our province has experienced a lot of death, and families need to come together to celebrate the life of their loved one. They can do that now with 15 people, not including those conducting the service. We've also had many people asking us about camping. So effective June 5th, private campgrounds can open for all types of campers, but capacity of the campground is limited to 50%. So operators can maintain the 6 feet distance between campers. Provincial campgrounds will open in Nova Scotia on June 15th, and they will also be operating at reduced capacity, and the reservation line will open on June 8th. One thing I've discovered is Nova Scotia has a lot of avid campers, and we want you to get back out and enjoy the outdoors. Dr. Strang will have more information on the other activities that were about to take place. Dr. Strang.
Thank you, Premier. We are social creatures, human beings, and I know there's certainly a lot of interest and a lot of people really having a strong desire for gatherings. So let me just unpackage the gathering limit a little bit more and talk about some scenarios to help people really see what's possible and what's not allowed. When we say gathering, we mean things like social gatherings on your deck, in your house, or at the park. We mean arts and culture events like dance recitals, theater performances, and festivals. We mean faith gatherings and special events like weddings and funerals. We mean sports, physical activities, and sporting events. With the new limit the Premier has just announced, gatherings can now happen in groups of up to 10 people, but social distancing of at least 2 meters must be maintained. The limit is the same whether those gatherings are indoors or outdoors, with the exception that for 15 plus officiants for outdoor weddings and funerals. For sports and physical activity, 10 people can practice on a soccer field, for example, as long as they're maintaining the social or the physical distance between them. But they can't play a typical game of soccer because that would involve close contact. They also cannot have 2 separate groups of 10 on the same field. So it's a group of 10 maintaining physical distance per sport setting, per field, per ball diamond, per rink, per court. We see fitness facilities as businesses, and they are businesses, whether they're for-profit or not. So the gathering limit of 10 does not apply to fitness facilities. Instead, like all other businesses, they must have a plan that addresses how they control numbers to ensure social distancing, among other things like hand washing and increased hygiene. However, if a sports team rents a soccer field or the gymnasium at a fitness facility or a hockey team rents a rink, that team is subject to the gathering of 10. So the entire team cannot be on the soccer field or in the gym or on the ice surface. For faith gatherings, along with the drive-in services that have already been in place, 10 people can gather, keeping the physical distance between everybody, and that's indoors or outdoors. I would also, it's important that they continue to follow other safety precautions, such as not passing things like collection plates or communion between people. And we're saying that singing is highly discouraged because there's now evidence that people singing actually significantly increase the spreading of respiratory droplets, increases the risk of transmitting COVID, the virus that causes COVID-19. While many arts and culture events tend to be larger, there may be some that can function with 10 people and physical distancing. And if they can, those are okay as of today. For example, if it makes sense for have a musician host a small performance with 9 other people, all maintaining physical distancing, that would be fine. As I said, for weddings and funerals, you can have the gathering of 10 indoors, 15 outdoors, plus an officiant. I realize that certainly at weddings that there's a lot of people want to have a lot of other service providers, such as photographers, musicians, DJs, and food service. I hate to be a damper on these joyous events, but at this time we need to make sure that the numbers are limited. So the officiant is the only extra person, and if you want a photographer or a DJ or something like that, they would be included in your number of 10 indoors or 15 outdoors. This gathering limit also applies to businesses whose core function is creating gatherings. So businesses of this nature like theaters, concert halls, sporting events, at this time they can only operate with groups of 10 people and maintaining physical distancing. It's important to emphasize that in all these scenarios, we're saying physical distancing needs to be required. There is the exception, though, if people are, even if, as long as you're respecting the numbers, that if there are people within the same household or the same household bubble as part of that number of 10, they do not have to maintain physical distancing amongst themselves, but they have to maintain physical distancing from people who are not in their household or household bubble. I do want to mention 2 things that are not changing today. The first is the requirement to self-isolate for 14 days when people enter Nova Scotia. This requirement will continue for the time being, and we're an ongoing assessment of the necessity for that. But recent experience in New Brunswick just illustrates how important these requirements for self-isolation coming into the province remain. We're also not expanding the household bubble at this time. We are watching our epidemiology and will consider expanding the way that people can have close social interaction when we see how this first stage in the reopening is going. It's very important that we don't introduce too much risk of COVID-19 at any one time, and that we have the capacity to monitor the effect of any steps on the epidemiology. I recognize that this is a lot for people to digest, and that the things we have announced this week are certainly not a one-size-fits-all solution for everybody. Different settings and activities have different levels of risk, and we've had to take that into consideration and look at those different levels of risk at a setting-by-setting or sector-by-sector approach. The risk things that we look at are the number and how people are getting together, the chance of close contact, the ability, the level of control that could be maintained as you bring people together, the type of setting that if there is, for instance, things that actually have a lot of loud noise and people have to talk louder, they can facilitate spread of the virus. Behavior such as alcohol consumption, which create a lowered ability for people to maintain the necessary public health measures. All those things have factored into the decisions around what was announced today and what was announced on Wednesday. I know that some of this is confusing, that people say, well, why can I can go to a restaurant and there be 10, 20, 30 people are in that restaurant, depending on the size of the restaurant, as long as the tables are kept apart. But and that seems to be okay, but they can't go hug their grandkids, or they can't practice with their entire soccer team. It's important that people understand we recognize those, but this is about taking measured steps so that we can reopen the economy and loosen other restrictions in a careful, measured way. It's all about managing the risk from COVID-19. Everything we do to open up society and the economy introduces a greater level of risk and possibility of a resurgence of COVID-19. So we have to take these necessary steps, but in a measured or balanced way. And if we did everything all at once, that is just far too much risk and greatly increases the chance of COVID-19 recurring. It is not gone, even though our epidemiology looks very good. It is still here, and it's still circulating in other parts of the country and internationally. And as I've said previously, the way we respond to these changes, it's part of actually our new normal for the long term, living with COVID-19. It's again, people are. I know coming out of this, people are going to have a lot of questions and say, well, the situation A and situation B, there's just inconsistency between them. We spent a lot of time thinking about this. My team in public health, we've wrestled with this for the last few weeks about what is the right way forward and what recommendations we would make. We have to understand that the first step was in recovery needed to be opening the economy, allowing people to get back to work. At the end of the day, having a strong functioning economy and having people working, that's an important measure that improves people's health. So from a public health perspective, even putting the economy first needs to be part of that. We also know that it's important for people getting together, that it's important for vibrant communities, important for people's collective and individual mental health. But that as we get people together, the more people, as I said, that carry some inherent risk for COVID-19. So we have to do this slowly and carefully. We recognize that people want to get together. We recognize the soccer team wants to practice. We recognize the full church wants to get together. But we have to do this slowly and carefully. We ask for your patience. We will be working at this, but we have to, I guess, do this in a measured way. At the end of the day, my responsibility is to make sure that I'm putting forward things that I feel are the right balance, that produce the right level of protection against COVID, not introducing too much risk, but also allow the ways for us to recover with our economy and society. So we continue to ask Nova Scotians for their understanding and their patience, their cooperation with the public health direction as we work together to reopen the province in a measured way. We'll make progress, but we're going to do it safely and manage the pandemic. Before I end, I do want to recognize that there's been a lot of questions and concerns coming around daycares. I just want to explain that the role of myself and my team was to look at whatever plans for daycares and make sure that we were comfortable that the daycares could operate in a safe manner. We received information earlier this week that unfortunately did not have the sufficient detail that would allow an individual operator to take all with full understanding of all the specific steps they would need to take to actually open the daycare in an appropriately safe manner. So we said we cannot. We're not ready to go yet. So we continue to work to provide on providing this level of detail necessary for daycares that they can reopen as soon as possible in a safe manner. Our target is for June the 15th, but I want the people to understand that the first priority from my office and the first priority on our recommendations to government that must be that we have to protect the health and safety of children first. Premier.
Thank you, Dr. Strang, and we'll be happy to answer any questions, Chrissy.
Just a reminder, each reporter will get one question and one follow-up in the amount of time that we have for today. First question goes to CBC's Mike Gorman.
Thank you. Dr. Strang, I wonder if you could talk a little bit about your thought process as you've crafted this reopening plan, both what was announced today and on Wednesday, while seeing what has happened in other provinces that have recently reopened that have experienced spikes. And Premier, how is the province going to enforce these new measures that have been put in place?
So that was our thinking all along, that we need to actually open things. That's in a measured way. That's why we've said as much as possible businesses can open, but we have maintained the requirements around physical distancing. In some of them we've put limits. Restaurants can only open up to 50% of their capacity. There's some places, as we said, where that their business model is built on bringing groups of people together. We've just said it's not. We don't have the level of safety yet and the confidence that we can open those. It's why we're putting limits on the number of people that can get together, as we've talked about today. So we're very cognizant, and we're watching certainly other provinces that have gone ahead of us, other countries, and well aware of the potential that you can reignite COVID-19. And along with that, we're making sure we have the appropriate surveillance in place. That's why we expanded our symptom list. And as I said earlier today, it is functioning the way we want it to. Testing lots of people, having a very low threshold for testing people who might have COVID, and we need to continue that as we move forward, that we have an active way to very closely monitor the cases of COVID-19, look at our epidemiology and our surveillance in an ongoing way, and then we can move forward and indicate what is the next direction we need to take with respect to reopening the economy, or do we need to put a pause on things because that's as far as we can go right now from a public health perspective.
Mike, go ahead with your follow-up.
Yeah, Dr. Strang, in light of those comments and how cautious we're being about the size of groups, I'm wondering if you have any concerns about the decision at the moment to go ahead with municipal elections in early October, and were you consulted about that decision before it was made?
So we've been asked to start to this week, or I was asked to have people of my team participate in conversations about the fall elections to bring a public health perspective. I've asked for a couple of weeks where my team is small, and we're totally focused right now on these first stages of our recovery and what is the public health role in that. But I've said very soon, when we have some capacity in the next few weeks, we'll be very willing to engage with other people in government about a discussion around elections and how they can be held safely, and bringing a public health perspective to that.
I think it's important to note for the people who are listening the fact that when the minister announced that, he said that issue would be reviewed further in when we looked at epidemiology and talked to health, but that municipalities should plan for fall elections.
Next question will go to CTV's Natasha Pace.
Thank you. Premier, earlier today there was a release going out saying that there were 23 new beds going to be available starting next month at a private assisted living home in Bedford for senior citizens. I'm wondering why that decision was made. Is this any effort to kind of separate some long-term care residents at existing facilities like Northwood before a second wave of COVID hits?
So we put a call out to all of our partners in long-term care who have facilities, whether they had some capacity, what that would look like. We had a proposal that came back from the Shannix Group that had 23 beds that we have we're in negotiations with, and now have concluded that we will have those 23 beds for the next 2 years at least. And we'll continue to look at what does the capacity look like as we begin to look at not only Northwood but long-term care across the province.
Natasha, do you have a follow-up?
I do, yeah. I'm wondering, Dr. Strang, you sort of explained this a bit, but I'm just wondering if you could just explain why sleepover camps are not permitted this year. You kind of touched on this, but I guess I'm just wondering why some things are permitted and some things aren't. Like, what would be the difference with that as opposed to having group campgrounds being open?
So the campgrounds are that, we're putting requirements around that, but ultimately families can make decisions about what they do and what they feel safe with. It's a very different environment, because they're then the family is going and they're in charge of how they conduct their own campsite and how they interact as a family, and then they make their own choices in there. It's a very different environment when you actually have a sleepaway camp that people do make a choice to send their kids there, but then there's a less level of control about what choices the families make within that. We also know that those camps are also inspected and to be sure they're safe at the beginning of each summer. So there is an obligation on the part of government. We have some level of oversight on those. We certainly felt that when you're bringing numbers of kids together for a week or 2 weeks, they're sleeping in bunkhouses together, eating together, activities throughout the day, that there's just too much of a level of risk there that we could anticipate being able to do these safely in any way this summer. So that's why we're announcing those are not going to happen this year. We're no different from other provinces. We're not unique in this at all. It's just, again, I come back to the risk, and it's as part of moving forward, living with COVID-19, the current situation we're in. There's just too high a level of risk of those in a large group of kids together that we have some obligation to have some responsibility for. That we said that is just not a safe thing that can happen this summer.
Next question will go to Global's Alicia Draus.
Thank you. I'm just wondering, we've learned a lot over the past, 11 weeks about COVID-19, not only from experiences across Canada, but also internationally. I'm wondering if there's anything, though, that we have learned specifically from what's happened here in Nova Scotia.
So there's a number of things we've learned. And the lessons that I see all the time. We've learned how we're much better prepared in terms of we built our laboratory capacity. We have a robust system of 811, the lab, our health authorities with their assessment centers, Scotia linked to public health to do follow-up. That's been it's been a foundation of how well we've been able to manage COVID-19. That interaction between all those parts of the healthcare system. I was on a call earlier today with colleagues in continuing care, and I thank them for I've seen remarkable ways in which the continuing care sector, which can be is a fairly broad and diverse organizations and businesses involved there, but now they have come together and worked very collaboratively to solve issues and crises as they've occurred, and also how the continuing care sector is working in a much more integrated way with our hospitals. Those are all things that successes that we need to sustain those. The other thing I've seen is lessons learned is how Nova Scotians, in many ways, so many stories about Nova Scotians listening and picking up the challenge to care for one another, create caring communities, look after one another in these challenging times. I hope that those are things that we don't lose those just because as we move out of this first wave of COVID, that building a more caring, thoughtful community that looks after each other is one of the legacies perhaps out of COVID.
I would also say to you that one of the big lessons, and I think that we've learned, is that an asymptomatic person can carry the virus and pass it on. Before the virus hit our province, there was still globally across the world was talking about an asymptomatic person could not pass on the virus. I think it's well known here. That's how that virus ended up in some of our facilities. So that is as an important lesson for all of us as we move into whether it's a second wave or, quite frankly, continue to provide care in facilities across the province when it comes to PPE and those things to help ensure that someone is not unknowingly passing that virus on.
Alicia, do you have a follow-up?
I do. This one is in regards to sports. Dr. Strang, you talked a little bit about sports today and that they could potentially be allowed, but not as we know it, and we'd still have to follow the group gathering rules, so the 10 people, and the physical distancing rules. And you used soccer as an example. I'm just wondering if we will see the possibility of recreational sports kind of more as we know them at all this summer, or if that's something that's just not going to happen.
So we continue to work with my colleagues in the Department of Community Cultures and Heritage, and through them into Sport Nova Scotia. I know that there's active conversations that all the provincial sport organizations are working at ways that they can focus on two key things. Summer sport camp opportunities for kids in a safe manner, but also how they can actually have their sport conducted in a safe manner. And there's also discussions at a national level. The national sport organizations are Soccer Canada is talking to Soccer Nova Scotia, who's talking to all the local soccer clubs. So there's lots of conversation within the sport world about how you do this. Some sports are much more challenging than other sports. Certainly individual sports, not so much of an issue. Some team sports can still be done close to normal or as normal as we do safely. But it's the higher contact sports like soccer, rugby, football, etc., which need and hockey, that they have to be very thought through very carefully, and the sport organizations, as I said, both nationally and provincially and locally, are actively looking at how they might do that.
Next question will go to Keith Doucette with the Canadian Press.
Good afternoon. Dr. Strang, I'm just wondering, I know it's an isolated case in New Brunswick, what's gone on up there, but again, I'm wondering, as we open, did it give you any pause? And what do you think the message is for people here in terms of what their requirements are in terms of making sure that something similar doesn't happen here?
So the message in that is really about the importance of self-isolation when you cross borders. That's the real reason why we have that, is we want to make sure we're minimizing the chance of somebody bringing, as we're getting COVID-19 under control here in Nova Scotia, we really want to minimize the chance of somebody bringing it from another jurisdiction, whether it's from another province, or we also need to think about people coming in from outside of Canada. So what it shows us is the importance of very closely monitoring our borders, having strong measures of requirements as people come into this province, and at a national level coming into our country, that we need to be very thoughtful about how and be very careful about how we lift those border restrictions.
Keith, do you have a follow-up?
Yes, it's for the Premier, and it's on behalf of a colleague. It's revisiting the Northwood issue, Premier. I know you said that there are some talks going on about what may have to happen there in the future. And what I'm wondering is, will the province commit to funding renovations at Northwood to increase space for rooms and in common areas? And if you can't, will you provide funds to Northwood so that it can operate with fewer residents rather than decreasing funding in that instance if they can't?
There was ongoing conversations, quite frankly, before COVID with Northwood about what would a redevelopment look like in their facilities. That obviously is ongoing. There was conversation about long-term care with the Prime Minister last night. We will continue to work with Northwood, and I want to say to Northwood and those that work in that facility again, how proud I am of the work they're doing. When I hear families who have lost a loved one, they're talking about the wonderful care that they continue to receive. But our department will work with Northwood and other partners to continue to make sure that we're providing the appropriate number of long-term care and make them, we recognize this is going to be a challenge. when we start moving towards in our single rooms in facilities that were not built that way. We obviously know there's going to have to be some work done, and I want to assure those at Northwood and quite frankly in other facilities that the province of Nova Scotia and the government of Nova Scotia will be there to work with them as we find our way through this. I will say this to you, and I raised the issue last night. I think, well, Northwood is the largest facility east of Montreal. When we look at what's happening in central Canada and the number of deaths that has taken place, some are not-for-profit, some are for-profit facilities. I don't think that's the question, in my view. The question is, what is the appropriate size, separation? Those are the kinds of conversations that we need to continue to have. We'll have those with Northwood, and it will be with an eye to provide and continue to provide top-quality care to our loved ones, at the same time making sure that we're keeping them viable.
Next question will go to John McPhee with the Chronicle Herald.
Thank you. Dr. Strang, with the reopening of campgrounds, I would imagine there's going to be a lot more people on the roads. So I'm wondering whether the prohibition on using public restrooms is expected to be lifted anytime soon.
So I'm not sure. There's never been a prohibition on public restrooms. That has never been part of the emergency order or the public health order under my name. So it may be that individual businesses were choosing to close their restrooms. I would hope that they are thinking about how they provide a service to the public with the public restrooms. They also are making sure that it's part, as we talk to businesses that have restrooms as part of their operation, make them available. We certainly talked about the importance of managing the numbers at any one time in restrooms, the importance of cleaning, but we absolutely have to make sure that as we open up our communities, that public restrooms are accessible.
John, do you have a follow-up?
I do. This is for the Premier. The NDP wants the province to pay for 6 days for people who don't have any at the workplace, and they say this is particularly a factor given the COVID risks and the continued delay in opening daycares. Is this something the province should consider?
So that was part of our call last night with the Prime Minister. This is something that Premier Horgan has brought up from British Columbia around sick days. The Prime Minister obviously has spoken on the issue. I very clearly said to the Prime Minister last night, we would certainly welcome the federal government if they wanted to provide support to provide sick days related to COVID, that they were specifically COVID is the factor, that are wanting people to be tested, that the federal government should fund that and be part of that. I think every premier across the country supported that. We also said this was not healthcare funding. This was a funding program that the national government should put together based on COVID alone. And when we found a vaccine for COVID, those days, the federal government continued to pay for those days or they wouldn't exist. And that if there were other sectors looking for sick days in the province, that they would continue to negotiate that at the bargaining table. I don't think anyone wants me to negotiate in public. Every union I know in the province doesn't want me to negotiate in public, and I won't.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Premier, I understand that a safe plan for daycares was not reached in time for the reopening to coincide with the economy reopening. Is there a plan to address unmet childcare needs facing families as you've asked Nova Scotians to get back to work?
Well, as we can, it's funny, we continue to work with the private sector. I can't go against public health. I'm not sure it is about the health and safety of our children. And I said at the very beginning, I'm not about to expose our kids to a virus. We've seen what's happened. We'll continue to work, and I believe employers have a role here. As we are now starting to open up our economy, I need employers to ensure that they work with their employees who are having challenges around child care to ensure that they schedule appropriately or help support them in providing that child care at the beginning.
Lindsay, do you have a follow-up?
Yes, thank you. For Dr. Strang, you said that the work on the daycare plans with child care operators is still ongoing. Can you give us some more details on the progress of that plan? Are things on track for June 15th? Is there any chance things would be allowed to open sooner?
So I haven't had an update today. I know my team has met in the last couple of days with their colleagues in the Department of or the Early Childhood Branch in the Department of Education and Early Childhood Development, knowing that the level of detail that's necessary. There's a lot. We're looking at information that other provinces have developed, trying to pulling all that together. Anticipate I'll get an update on Monday. They continue to work on that. I think we're certainly. Our target is certainly to be by June the 15th.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang, I wonder if you could talk to me about testing. A couple of weeks ago, you had made the statement that because the number of people exhibiting symptoms was lowering, that you were thinking about going into doing some randomized population studies for testing. But then after that, the number of tests seemed to decline to, a couple hundred a day. And then now we're back up to over 1,000. I think yesterday was the highest number you did. So are you doing those randomized sampling of asymptomatic people, or is something else at play? If you're not doing them, why aren't you? And if you're about to, how will you go about that?
So actually, the numbers have come up because as we expected, and as I said when we announced this a few days ago, Tim, that we broadened quite substantially the symptoms that we would look to if that people had these new or worsening of chronic symptoms, and they could fit a category of possibly having COVID, and that was based on our growing understanding of how COVID presents in more diverse ways. And as we broadened that, we absolutely knew that we would get more people calling 811, more people being directed for testing, and that's exactly what's happened. And the good news is, as we were hoping to see, that as we broaden that testing, we'd still see very low or no numbers of COVID-19. So the first step on our ongoing surveillance was actually broadening this symptom list, and we were planning on this. We just had to, we were working, seeing what happened in other provinces who were a bit ahead of us on this, and we're also building to making sure we had the right capacity, 811 and the assessment centers in our lab. We're still looking at the options about how we might do selected populations of asymptomatic people in a very focused and targeted way. We need to do this thoughtfully, working with the lab and our clinical colleagues, because there's a lot of risks, as I've said earlier. If you just broadly test a lot of asymptomatic people, you're going to get a lot of false results out of that. So we have to be thoughtful about how we do that. But the first step in our plan was always to broaden this symptom list as the evidence based on the clinical evidence of how COVID presents, and that's what we've done. And we're seeing the impact of a significant increase in testing, and we need to continue that, because this is how we're going to anybody with a suspicion that they could have COVID. We got to make sure that they're tested early, and we need to sustain this. The list of symptoms may change over time, but our whole testing strategy has been based on testing people as early as possible who have symptoms that could be COVID.
Tim, do you have a follow-up?
I do. Premier, Dr. Strang, I think correctly has said that this rollout is necessarily going to be somewhat confusing. Just there's a lot of moving balls, and I don't think anyone would criticize anyone for that. But given that there's this confusion in a lot of different kinds of workplaces, different kinds of rules, different agreements or plans by the different industry groups, do you have any plans to increase or hire more workplace inspectors? It's not necessarily for in terms of finding people, but in terms of an educational element to explain to workplaces and their customers about what's going on.
So we, prior to this, we would have had workplace safety people actively involved at different levels, whether it's health inspectors, whether it was alcohol and gaming inspectors that would continue to be part of the system, will be part of this. Quite frankly, the public are going to be looking for this and help us continue to go forward. But we will have inspectors out in the field, but I can tell you I have all the faith in the business community of this province and Nova Scotians who recognize that there's been a lot of sacrifice on their part on all Nova Scotians' part to get us to the point where we can start opening up. And they understand that by opening up, we need to continue to practice those public health protocols that Dr. Strang has put in place, the 6 feet distancing, staying within our family bubble, washing our hands, in order for us to prevent the spike of going forward. Business owners don't want their business to close down again. Nova Scotians are not looking to have more restrictions put on. They want those restrictions to be lifted. We will continue to work with those sectors through all of our different departments and agencies, but I have all the faith that the business community and the businesses in our community, along with Nova Scotians, their patrons, will ensure that the rules associated with public health are followed.
Next question will go to Kyle Shaw with the Coast.
Thanks. For Dr. Strang, the Coast has heard a report that physiotherapists who work inside hospitals are not being mandated to wear masks, and therefore they're not being provided with masks. So they'd either have to provide their own or go without, and that's in the hospital where most other workers have to wear masks. So is that a provincial policy around in-hospital physiotherapists, or is that maybe just a one-off situation?
So I was on a call this morning, and certainly the health authority is they have a number of other steps in place that they feel that they do not have to mandate masks, general mask wearing for everybody. They have specific occupational health and infection control measures in place. So I think I'm comfortable they have the right expertise to make that decision. That you would have to ask the NSHA and IWK on the details on that.
Kyle, do you have a follow-up?
Yes. Okay. And then back to today's gathering news, and just to clarify and sort of following on to Alicia's question. So we're seeing for a sports team or a play or a rock concert, there could be 10 people total in the gym or the theater, and that includes the performers and the coaches and the spectators, and they all have to stay 2 meters apart. So we're like far away from viable large events or festivals here. Do you see us getting to bigger events on any sort of foreseeable timeline, or is like gatherings of hundreds of people just a thing of the past?
So as I've said, and I've said here on these briefings before, I've said in all my engagement sessions with various sectors that if things go well, we may be, by the end of the summer, we may be able to get to a number of, say, 50 that can gather. Along with that, and this is consistent with what other public health people are saying across the country as well as internationally, that events that are based on bringing 150, 200 or more people together have to be, are very high risk. And that we have to think very carefully about how we may introduce those, if at all, in our world of living with COVID. So I know that raises a lot of questions and concerns, but it's one that we have to really recognize that those are extremely high-risk environments, and all you have to do is look at how the first wave of COVID-19 and a role that they played in a significantly contributing to the spread.
That's all the time that we have for questions today. We do have a point of clarification.
Yeah, so questions come to me about clarifying about when my comments are on daycare, what was the information that put the brakes on the plan? I would say it wasn't what the information was, it was the lack of detail. So what we had what I had in front of me, what my team brought to me was that we're very high level, and it was based on recommendations to do various things. And when I looked at it and we had some conversations with my team, who I have every confidence in, they said this does not allow a daycare operator to make specific plans that we could then work with our colleagues in the Department of the Early Childhood branch to be able to say with confidence that daycare has a plan that we are comfortable that would protect the safety of children and the staff in that daycare. So we're working right now with as I said, with our colleagues in the Early Childhood branch and engaging with the licensed daycare sector to produce the level of detail that's necessary to produce concrete plans that can assure the necessary level of safety.
Thank you.
Thank you, Dr. Strang. And I understand there are still lots of questions and concerns, and daycare is one of them, as Dr. Strang just spoke about. Obviously, we wanted the daycare and the daycare centers and economies, the economic future of our province to reopen at the same time. But when public health comes to me and says the plan is not ready and they need another week, why would I go against that? That is about the safety of our children. Too many other provinces have reopened their daycares too soon, and look what's happened in those provinces. Some of you are saying, so why didn't you change the date of reopening the economy? Because people need to get back to work, to pay the bills, to take care of their families. Not everyone will be going back right away, and it's 10 days from June 5th to June 15th. And I know those days will be long for people who are going back to work right away and who need childcare. And I am asking business owners to please respect your employees who have issues with childcare during these 10 days. We need to take care of each other. We need to be kind to each other. We need to support each other as our province tries to come back from COVID-19. And today is a good sign that we are on the right track, and I am so proud of all of you for sticking to the protocols. But I know you're getting anxious. Many of you are asking, when can I expand my bubble and get the long-awaited hug? The hug is both a beautiful and dangerous thing. The close contact means so much to all of us, but it is the very thing that could set our province back. You can see more of your family members now with the gathering limit gone to 10, and you can hang out together, watch your grandchildren play, but to protect them and yourself and the health of our province, no hugs, kisses, or handshakes. Stay 6 feet apart for a little longer. If we continue to flatten the curve, we will be able to lift up your spirits by taking down more restrictions.